Repetitive nerve stimulation. Connect the recording electrodes to channel 1 inputs of the amplifier and turn on the amplifier if necessary. The monitor trace shows the signal baseline. It should appear flat, indicating minimal noise and interference. As we enter the test, we are in the Stim setup mode. Increase the stimulus intensity to record the compound muscle action potential. As we increase the intensity, you can see the response in the bottom left window, and its amplitude is shown in the result table. Here we go. Note the response getting larger. Also note the amplitude. It is no longer changing. We'll now increase the intensity a little bit more to make it supramaximal. Let us now select the repetitive stimulation mode. The result table shows the stimulation protocol. In our default settings, we will have a baseline at 1 Hz, then a second baseline at 3 Hz. We'll stimulate post-exercise immediately, then at 30 seconds and 1 minute, and so on. This protocol can be configured and modified by the user. One can define the timing between different stimulation trains, the number of stimuli within a train, and also the frequency of stimulation within a train. Let's begin by performing our first baseline study at 1 Hz. Stimulate. We have recorded 10 compound muscle action potentials. Their amplitudes can easily be seen from the top trace, and there is no change in amplitude. This is a good quality repetitive nerve stimulation study. In the bottom window, we can see the details of the compound muscle action potentials, and once again we do not see any change in the amplitude. The amplitude of each compound muscle action potential is also shown graphically using the bar graph. There are 10 vertical bars, each bar representing one Cmac. The amplitude of the first Cmac is indicated by the first pink bar, and the amplitude is also shown in the result table, 7.5 millivolts. The amplitude of the fourth Cmac, indicated by the green bar, is compared with the first one, and in this recording there was no change, and therefore the amplitude decrement is 0. The system can also calculate decrement for the last stimulus, the 10th one, and that's why it is shown in green color. However, we have elected not to show that result in this default configuration. We can look at the individual amplitude measurements by clicking on the results icon. We can see the stimulus intensity for each stimulus, the area, and the amplitude values in the left window. We can also see the bar graph in the bottom. Exit the result mode by clicking on the result key. Repetitive nerve stimulation is very sensitive to movements and artifacts. They affect the shape of the compound muscle action potential. Subtle changes in the Cmac waveform can be assessed better by superimposing them. Your system may have a function key or an icon for superimposing traces. If not, you can right-click into the window and from the pop-up menu choose Superimpose. Notice that we have excellent superimposition of traces, indicating minimal movement, artifacts, noise, or interference. To show the signals in raster mode, right-click into the window and undo the superimpose mode. We have finished the first baseline study. We will now perform the second baseline study. Use the next trace key. This will save all the traces. it will automatically set the stimulation rate as configured. So in this case, it is 3 Hz. Remember, our previous train was at 1 Hz. Let us record the second baseline study. Once again, we have got good quality recordings. And when we look at the result graph, now we have 2 bar graphs on the right side. I'm going to maximize the window by double clicking into the bar, or I can use this maximize icon. So the first bar graph is for the baseline and the second one is for the second baseline. These amplitude bar graphs are most useful to assess the quality of the study as well as any abnormalities such as decrement, facilitation, etc. I can click on the icon again to restore this window. The result table shows that the amplitude of the first response was 7.7 and there was a decrement of 0.5%. We can look at the result table in greater details. I can double click on this window. Here are the additional results that are also calculated. We have already seen the amplitude of the first response and the decrement using the fourth one. We can also calculate the facilitation in amplitude. In this case, our baseline amplitude at 1 Hz stimulation was 7.5, and then in the next trace it was 7.7, so there was a 2% increase. Similarly, we have measurements for area, decrement in area, and facilitation in area. I will double click at the top to return to the normal display. We have now done our baseline studies. It is time to do repetitive nerve stimulation after exercising the patient. This can be done in 2 ways. We can have the patient exercise and then the operator can keep track of time for stimulation. We also have the facility to keep track of time automatically, and this is done by turning on the auto acquire mode. We'll now have the patient exercise, but before that, use the next trace key so that we are ready for recording. Have the patient exercise. We can listen to the EMG activity during exercise. As soon as the patient relaxes, we will deliver a train of stimulations. So this was immediately after exercise. Notice the amplitude is slightly higher, 8.4, indicating some facilitation. The decrement is 1.4%. Note that there are 2 clocks. The first one is counting up. This is the time since the first stimulation after exercise. Second one is counting down, indicating time remaining for the next stimulation. That was a warning at 5 seconds. And now this was the stimulation 30 seconds after exercise. The first clock continues to count up, indicating once again the time since exercise, and the second clock is counting down. Notice that by automation, performing the repetitive nerve stimulation test becomes much easier. We can continue with additional stimulation as necessary and then exit the test.